Interpreting arterial blood gases. So in order to be able to interpret a blood gas, you need to have this information in your mind at all times. All right, so let's break it down. So we have our pH level here. So we know that if our pH level is decreased, we're going to be acidic, and if it is increased, then we will be alkaline. Next is our carbon dioxide. So carbon dioxide is related to the lungs and respiratory, right? Because we breathe off carbon dioxide. And we need to know that it is an acid. So 35 to 45 is the normal range of carbon dioxide. So if our carbon dioxide levels are increased, we're for sure going to be pretty acidic, right? We're going to be acid. If our carbon dioxide levels start to drop, then we're going to become more alkaline. Next is bicarb, so bicarbonate. This is related to the kidneys. The kidneys regulate bicarb, and we're going to call this metabolic. So the normal range is 22 to 26, and bicarb is alkaline, aka basic or a base. So if you have high levels of bicarb, then you're going to be more alkaline. If you have low levels of bicarb, you are going to become acidic, acid. So this concept you'll need to memorize and understand in order to read or interpret ABGs. Compensation. So we know that the body has compensatory mechanisms that kick in when the acid base is not balanced. So there are three categories: uncompensated, partially compensated, and fully compensated. Uncompensated means that we have an abnormal pH. It's either an acidosis or alkalosis, and one of these values is abnormal, either your CO2 or your bicarb, and that's the culprit. The one that's abnormal is the one that's causing the issue. That is uncompensated. Partially compensated is the same thing. The pH is abnormal, so it can be an acidosis or alkalosis, but both of the values are abnormal. And that means that one is the culprit and the other one is trying to fix the problem. So it's partially compensated. Then we have fully compensated. So this means we have a normal pH because something is working, something is compensating. The body is fixing the pH level. So when we look at our values, both of these are going to be abnormal. And their values will tell us who's the culprit there. And it gets a little complicated, but it's like a little puzzle that you can figure out. And so we'll do a few examples. So when you are beginning to interpret your ABG, the first thing you're going to do is look at that pH and see whether it is elevated or decreased. You look at the carbon dioxide, you do the same thing, but you need to remember whether an elevated result means acid or alkaline, and whether a low result means acid or alkaline. So you need to distinguish the two for both the bicarb and the carbon dioxide. Then you're going to match it to the pH. Like if the one is acid and the pH is acid, then that's the culprit. So let's continue. So let's try our first example here. So our pH, we always start with pH, is 7.3. That is going to be decreased, and that is going to be an acid. Our CO2 level is 36. That is normal. Our bicarb level is 20, and that is decreased, and that is acid. Okay, so what is this? We're always going to start with our pH, and it's telling us we're in acidosis. And are we metabolic or respiratory? So our respiratory CO2 is normal, and our bicarb is acid, which matches acid-acid. So this is going to be metabolic acidosis. Now let me show you how to use Rome. So here we have Rome. So the RO in Rome means respiratory opposite. The ME means metabolic equal. And it's referring to the arrows. So let's see. So pretend like we haven't worked it out yet. Okay, so don't look at this. Let's start from scratch. So like before, we're going to start with our pH. Our pH is 7.3, that's decreased, and that's an acid. Our CO2 is normal, and our bicarb is decreased. So when you use Rome, you don't have to indicate like the arrow down. What does that mean? Does that mean bicarb is acid or alkaline? You just have to put the arrow, because in Rome, this opposite and equal is referring to the direction of the arrow compared to the pH. So with here, our pH is down, and we have a matching arrow here. This is quote equal when it comes like to the ME equal. So this is metabolic acidosis. So we get the same outcome. Personally, I like to work it out the normal way, just the basic way. That's how my brain works. But if Rome works for you, you can totally do that. You can use it on different types of ABGs, whether they're compensated or uncompensated. You just kind of have to be careful when you're matching the arrows. Okay, next example. Our pH on this one is 7.49, that is increased, so that makes us alkaline. Our CO2 level is 30, which is decreased, and that is also alkaline. Our bicarb level is 25, which is normal. Our pH tells us we're in alkalosis. And are we respiratory or metabolic? So our metabolic is normal, so our respiratory is abnormal. It's alkaline. Alkaline matches with the pH, so this is respiratory alkalosis. Now let's try the Rome method on this one. So we have our RO, reminder, respiratory opposite, and then our ME, which is our metabolic equal. So we start with our pH is increased alkaline. Then we have our CO2, which is decreased, and then our HCO3 is normal. So these arrows are opposites. So we have respiratory alkalosis. Again, if this works for you, you can use the Rome method. If not, you can do it the longer normal version. Next example, pH of 7.29, that's decreased, that's an acid. CO2 level of 47, that is increased, that is an acid. Our bicarb is 24, that is normal. Our pH is telling us we are in acidosis. Are we metabolic or respiratory? So our metabolic value is normal, our respiratory is increased, and it matches acid and acid. So this is respiratory acidosis. Next example, pH equals 7.49, that is increased, we are alkaline. Carbon dioxide is 33, that is decreased, we are also alkaline there. Our bicarb is 24. That is normal. And let's see what we have. So we're going to go by the pH, which is alkaline. So we are in alkalosis. Is it metabolic or respiratory? Well, metabolic is normal, respiratory is abnormal, and alkaline, the same. So it is respiratory alkalosis. Next example, pH 7.3. 7.3 is decreased, so that's an acid. CO2 is 50, so that is increased, that is an acid. HCO3 is 24, that is normal. Our pH tells us we're in acidosis, so we'll write that, acidosis. And are we metabolic or respiratory? We are respiratory. Because respiratory value is abnormal, acid and acid match. Next example, pH is 7.5, that is increased, that is alkaline. CO2 is 30, that is decreased, that is also alkaline. Bicarb is 24, that is normal. So we are in respiratory alkalosis. And now we have our last example. So our pH is 7.47, that is increased, that is alkaline. Our carbon dioxide is 31, that is decreased, that is alkaline. And then we have our bicarb level is 20, which is decreased, which is acid. So this is the first example we have where all three values are abnormal. So let's first see what issue we have here. So we're going to follow what pH tells us, which is alkalosis. So we are in alkalosis. And then are we respiratory or metabolic? So we need to figure out who the culprit is, who's causing the alkalosis. Well, this one is because it's alkalosis. It matches the problem of the pH. And I'm not talking about the arrows, I'm talking about the imbalance. So alkalosis, alkalosis, so this is going to be respiratory alkalosis. Now, what is the significance of this bicarb level being so low, causing it to be acid? Well, this means the body is trying to regulate it and try to fix the problem. So this would be respiratory alkalosis with partial compensation. Okay, so the body is trying to fix it, but it's not fixing it because we're still in alkalosis. If this were fully compensated, then our pH would be normal, but these values would still be abnormal. So that is the only partial compensation example that I'm going to give you because you don't need to know that for the exam. In the packet that I gave you, there are several that you can practice on because they're kind of fun. But if you wanted to go over more of those fully compensated and partial compensated, just let me know, I can do that. But for now, everything that I just talked about is pretty much what's, it's very basic what you'll need to know for the exam. Okay, and that concludes ABG interpretation.